Back with 3 East Tennessee-based charities who handle the basics. They are reaching people in desperate need of medical care, food, as well as education and a little Christmas cheer. Emmett, we'll talk more about that in a minute. But Chris, let's start with you. What's an anecdotal story that you think captures the mission of RAM and that you have witnessed?
You know, as the last year, a year and a half, 18 months has kind of wore on, I think of the story of a patient who was trying to get services a year and a half ago at a clinic that was canceled. This patient hadn't had glasses in more than 5 years. The glasses that they had broken, and so they were just suffering day in and day out without the ability to see. And so they waited until we came back to Jamestown, Tennessee to do a clinic earlier this year. And that patient came probably about 36, 48 hours before the clinic started to sit in line and wait to ensure that they were able to get in to get a number. And that patient was able to get in, have a full eye exam, and walk away that day with a pair of glasses. And I just think that's kind of the story of what people are seeing around the country right now and right here in our own backwoods is people are in need of care, and they've not been able to get it for a while because everything has shifted. And they're waiting and desperate for this help. And so being able to provide these clinics, provide that help for them and really warms the heart for what we're doing.
Imagine waiting 5 years for some new glasses. That really drives it home. Thank you. Emmett, how about you?
You know, Chris, I love that story. Y'all have been such a blessing to so many people. We've had instances where individuals helped by the ministries we help their community have benefited. But I think one of the ones we ran across this past year that really was impacting, we had a ministry center that lost their building. That means they couldn't handle the things we were blessed to send them to give out in their community or do some of the services they do. So through the compassionate generosity of Friends to Our Ministry, we surprised them with a modular kind of storage building. Every penny was given to buy it. We were able to surprise them and give it to them. And it was a very emotional moment, but it allowed them to keep doing ministry in that area. And I sent a social media out about that, and I called it "Sometimes We've Got to Help the Helpers," and we all do.
Well said, Emmett. How about you, Elaine? What captures Second Harvest and the impact it's having on, as you mentioned, 18 counties across our region?
Well, I said earlier, we're a distribution center. We do work with RAM. We have given out bags of food when they are doing their clinics. Mission of Hope and RAM are phenomenal partners and so honored to do that. This year, because of the way our world has gone, we had a distribution through our parking lot, about 600 families. And John, it's so important for me sometimes because I can forget what we do because we don't see the clients. But we had, again, 600 families drive through. We were able to give them a lot of food. And the one that rings out to me the most is a mother and her daughter who were not able to get into public housing and they were living out of their car. And it was really hard to get the food in the car. Just to be able to see what you're doing, whether it's RAM or Mission of Hope or Second Harvest, it's so grounding. And as Emmett said, the giving's been off the charts for us. We are so grateful to this community. We've been able to do it because of that.
All three of you, your organizations do so much to help people who really need it. Without what you do, there would be a serious gap in service. So I'm curious, we are approaching Christmas, the holidays. Is there one wish? Things have been sort of good, sort of rough for all of you and your organizations as you go about your work. Is there one wish that each of you would wish you could have that would help things out a little bit? And Chris, let me start with you.
You know, I think for us, it's the wish of being able to provide more services through the volunteers that come. We have equipment to use. Being able to provide these clinics, help people in our own backyards. And as Emmett and Elaine have said, again, it takes partnerships across all brands. It takes all walks to be able to provide these services, whether it's providing a free pair of glasses, a Christmas present, or even a meal to patients. It's just continuing these groups to work together so that we can provide all the services in need for our communities.
And Emmett, what about you?
You know, John, I got to tell you, it's not for any one thing for our ministry. It's for the good health of those that help us, and maybe even more so of where we go. In rural Appalachian areas, the the COVID issue has been devastating, and it's felt in all aspects of the community. And at the school level, the teachers are so overwhelmed where we go. I hope and pray for better health, and that we get through this continued serious situation in our country.
Elaine?
The same. We've had 18 months plus of just devastating stories. I wish for the healing of so many families with the addictions and the emotional illnesses that people have. And they will never, until they get clean, be able to provide food for their families. And so we depend on our partners in RAM and Mission of Hope to get that done. But there's so many hurting people out there that I would love to just put a wand of love over them and get them out of the situations they were in.
When we come back, we'll talk dollars and cents and why these charities score so high when it comes to Charity Navigator and other sites that look at where the dollars go and who they serve. We're back with that right after this.